The muscles that move our laryngeal structure around can be classified into two types: intrinsic muscles of the larynx, which connect the laryngeal cartilages to one another and have a variety of functions for controlling phonation, and the extrinsic muscles of the larynx, which have an origin or an insertion outside of the laryngeal cartilages that function to stabilize the larynx or move the larynx up and down. This video will cover the intrinsic muscles of the larynx in detail. The extrinsic muscles will be covered in a separate video. There are several types of intrinsic laryngeal muscles. There are adductors, ADD ductors, which bring the vocal folds together and close the glottis. There are abductors, AB ductors, that open the glottis up. There are tensors that tense the vocal folds, and relaxers that untense the vocal folds. All of the muscles discussed here come in pairs, one on the left and one on the right, unless otherwise noted. Our adductor muscles include the lateral cricoarytenoid muscle, often abbreviated as LCA. This originates from the lateral surface of the cricoid cartilage, courses upward and backward to insert into the muscular process of the arytenoid cartilage. Contraction of this muscle pulls forward on the muscular process of the arytenoid cartilage that turns and rocks the arytenoid cartilage inward and downward, bringing the vocal processes close together. This closes off the glottis across most of its length to make phonation happen. This muscle, like all of our intrinsic laryngeal muscles, is innervated by the 10th cranial nerve, the vagus nerve. Our other adductors connect the arytenoid cartilages to one another. There is the transverse arytenoid muscle, which is not a paired muscle, that extends horizontally in the transverse plane across the backs of the arytenoid cartilages symmetrically. Contraction of this muscle will pull the middle edges of the arytenoid cartilages together from bottom to top. This will close off the posterior part of the glottis. The oblique arytenoid muscles extend from the muscular process of one arytenoid cartilage to the apex of the other arytenoid cartilage. Contraction of this muscle will pull the upper tips of the arytenoid cartilages together, helping complete the closure between the arytenoid cartilages. Together, the lateral cricoarytenoid and the interarytenoid muscles bring the arytenoid cartilages together tightly, causing the vocal folds to be approximated, brought together, and closing off the glottis. The amount of muscular effort for these muscles determines how tightly the glottis is closed. The glottis would be closed lightly for phonation when you want to be able to push air through, but strongly for thoracic fixation where you want to keep the air in the lungs in place. Our abductor muscle, to undo the action of adduction, is the posterior cricoarytenoid, or PCA. This originates from the posterior lamina of the cricoid and courses upward and forward to the muscular process of the arytenoid cartilage. This acts as an antagonist to the lateral cricoarytenoid. Contraction of this muscle will straighten out the arytenoid cartilage, pulling the vocal process away from the midline and opening up the glottis, or abducting the glottis. Our tensor muscles include subparts of the cricothyroid muscle, so depending on which book you're looking at, they may only refer to the cricothyroid. Since this is an anatomy-specific textbook, it goes into more detail about subparts of this particular muscle. The cricothyroid has two parts, the pars recta and the pars oblique. The pars recta comes from the anterior cricoid cartilage beneath the arch and courses upward to insert into the lower thyroid lamina. Contraction of this muscle will rock the thyroid cartilage relative to the cricoid cartilage, and given that the vocal folds are attached to the thyroid cartilage at the angle of the thyroid lamina, this will lengthen the vocal folds. The pars oblique originates laterally to the pars recta and courses obliquely to insert between the thyroid lamina and the horn, the inferior horn of the thyroid cartilage. Contraction of this muscle, given its oblique course, will pull the thyroid cartilage forward and also lengthen the vocal folds because it moves the anterior commissure where the vocal folds attach away from the arytenoid cartilages, the other attachment point for the vocal folds. Our other tensing muscle is part of the thyroarytenoid muscle inside the vocal fold itself. This part of the thyroarytenoid is referred to as the thyrovocalis. It is the muscular core of the vocal fold in our 5-layer model of the vocal folds. It originates at the anterior commissure and inserts into the vocal process of the arytenoid cartilage. This muscle works as an antagonist to the cricothyroid. So if both the cricothyroid and the thyrovocalis are contracted, the vocal folds become very tense. Our relaxing muscle is the other part of the thyroarytenoid, referred to as the Thyra Muscularis. It originates laterally to the thyrovocalis and inserts into the base and the muscular process of the arytenoid cartilage. This part of the thyroarytenoid is larger than the thyrovocalis. This muscle contracts strongly. It can shorten the vocal folds by pulling the arytenoid cartilage directly toward the thyroid cartilage without causing any rotation or approximation of the vocal folds. So in the absence of any antagonist contraction, this will relax and thicken the vocal folds. Since all of these laryngeal muscles are innervated by the vagus nerve, neurological damage to the vagus nerve can either destroy or reduce the innervation of muscles that adduct the vocal folds, abduct the vocal folds, tense or relax the vocal folds. Voice clients that have difficulty achieving phonation or achieving adequate vocal intensity are commonly referred to see a doctor who specializes in the ear, nose, and throat for examination of the vocal folds and possible surgery. Here we have a black and white version of an image from the book. One particular muscle is indicated by the thin black arrow. Orienting yourself to this image, we have the V shape of the vocal folds, with the anterior commissure at the bottom, and the arytenoid cartilages up at the top. We also have the V shape of the thyroid cartilage. It's fairly clearly visible. And then underneath the rest of it, the round ring of the cricoid cartilage. So this particular muscle is between the arytenoid cartilage and the thyroid cartilage, nearer to the edge of the vocal fold. So that's going to be our thyrovocalis muscle. The other muscle indicated in this image with arrows in the original image would be the Thyra Muscularis. Here we have a different image of laryngeal muscles. Orienting ourselves to this image, it tells us we have a posterior view. We can see the epiglottis and the hyoid bone at the top, the thyroid cartilage in blue shading, the arytenoid cartilages with the little corniculate cartilages sitting on top, and then at the base, the cricoid cartilage on top of the trachea. So here we have a muscle indicated with the thin arrow that originates from the posterior part of the cricoid cartilage and wraps around the side to the muscular process on the arytenoid cartilage. That's going to be our posterior cricoarytenoid muscle. A similar type of question you could be asked, but as kind of a two-step process, would be for this particular muscle indicated, what does it do? So you have to identify that it's the posterior cricoarytenoid muscle, and then remember that that is our abductor muscle. Or you might be able to figure it out by thinking about, well, what happens if this muscle shortens? If this muscle shortens, the muscular process gets pulled toward the back. That's going to rotate the arytenoid cartilage and cause the vocal processes on the arytenoids to move away from each other.